I found out I had diabetes at the age of 9 on holiday in America, and at the time it was quite scary, but now I've learned to live with it and it's just part of my everyday life. I've got type 1 diabetes, which means I don't make insulin, so I have to have a pump which pumps the insulin for me.
Jamie was diagnosed in America, so obviously we had they talked us through his diabetes there. So when we came home, one of the nurses came round within 24 hours of his landing just to go through everything with us, because it's totally different in America. The blood sugars are read differently, and they just were great support for us. We had the dietitian, we saw the doctor, and we saw the diabetic nurse within a week of us being at home. They gave us the books, and we had to go on different injections as well. So it was sort of a learning curve all over again after we came back from holiday. But we did go to the hospital every week to start with, until you're confident that you're dealing with your child's diabetes and that you know enough about it to be taking the care yourself and looking after the children yourself.
I have to test my blood sugar before every meal or before I eat, and I'll give insulin according to how much I'm going to eat and my blood sugar. When I wake up in the morning, I usually just test straight away and give the insulin before I eat my meal, so that it can either bring my blood sugar down or keep it at the same level. And when I go to school, I usually play sports most days. I'll have to take it off if it's a contact sport, such as rugby. But I'd usually keep it on if I go to athletics at night, unless we're doing sprints, because sometimes it can fall off and that could damage the pump. I was given this pump in February by the staff at the hospital. It's improved my life a lot. I've got a lot more energy, and it's improved my blood sugars a lot. I'm not as high all the time, or not having as many lows, and the staff have helped me because they taught me how to use it well. I know the ins and outs of it, and I knew it straight away almost. For someone my age, it's really important that the staff at the hospital talk to me on my level instead of talking to me like they would talk to an adult. They talk to me nicely, they're always smiling, and the way they explain things is easier to understand.
It's good to have a good relationship with the staff, because then it gives you the confidence that you know they're at the other end of the phone if they're needed. Jamie's not been so well recently, he's had high blood sugars, so we as a family we deal with it, but you know that you've got that backup if ever you need them. And they have texted me over the last 3 days just to make sure that we're dealing with it, and they've given me answers over the phone. One of the doctors phoned at 8 o'clock at night on Tuesday just to make sure that Jamie was all right, because he did have ketones, which you know isn't good for a diabetic. But we've managed to get his blood sugars down without seeing anybody. But as I say, it just makes you feel a little bit better if you know that they're there for you if it's needed. So yeah, I've managed to do it ourselves, but at least they've been there helping us, you know, at the other side of the phone.
The staff are always kind. I actually quite enjoy going to the hospital. I think the chats with the staff are always beneficial, and I like to hear what they have to say about how I can improve.
If ever I've needed anybody, I've been able to get them. So I just think that's a great thing, really. And I think the training for the pump was fine. You know, we do read a lot, don't get me wrong. You know, I think you do have to read, like anything, you read around a subject, don't you? And each child's individual, so that, you know, the diabetes, different things affects them. But to me, it makes a big difference that I know that if I've got an emergency with Jamie, that somebody will help us.